So the reason why the CT scan picked up the fracture while the cortical fracture while X-ray did not is just due to the amount of contrast that X-ray has. X-ray doesn't have the best contrast, so it's not going to be able to catch those small cortical cracks. Like while unlike CT, where CT can take X-ray is more 2D, while CT is more 3D, and CT has better contrasting, better 3D sort of better 3D like contrast, and it allows you to capture it from different angles and such that the regular X-ray cannot. And then MRI, if there's persistent left hip pain and there's no visible fracture from a CT or an X-ray, the MRI is going to be able to catch that edema that the patient had earlier on, and it's going to be able to catch that fluid displacement and potentially clue you in on a smaller, very micro cortical fracture that CT and X-ray cannot. And then a progression that I would want is that I would want the first, so for inflammation phase, I want that bone fully casted and we just do passive light stretching range of motion. And then I would progress them after that, after they had less than 3 out of 10 pain with that sort of passive stretch of motion while they're kind of immobilized. I would then move them to, during that sort of soft, hard callus formation, I would want 25 to 75% about weight bearing as my benchmark with less than 3 out of 10 pain as we sort of work into those more functional movements, which then come with the remodeling phase, that full bone sort of final bone reconstruction. I would want full weight bearing, no assistive devices, boot or anything, and then I would want no pain there. I would want full functional movements, full weight bearing, normal gait pattern, and then a wide variety of tests, stairs, shoes, etc.